Okay, I think we're going to go ahead and get started here. So I just want to say hello. Thank you all for joining us this afternoon. This is Melissa McLean. I'm the marketing specialist for Phoenix Physical Therapy. Today, our team of physical therapists will discuss how they can help prepare you with prehab and aid in your recovery post-knee surgery. I'd like to introduce our presenters today. On my first slide, Samantha Bost is the clinic director from our Carlisle clinic. Devin Day is the clinic director from our Chambersburg clinic. Monica Johnson is the clinic director from our Etters clinic. Katie Karnas is the clinic director from our Harrisburg clinic, and Alisha Greene is the clinic director from our Lancaster clinic. Our experienced team of physical therapists, occupational therapists, and speech therapists across the Phoenix family are available to help ease your pain by providing prehab before an upcoming surgery or as you recover from a recent illnesses. We invite you to visit our website at phoenixphysicaltherapy.com to learn more. If you have questions during today's webinar, please use the chat feature to ask a question at any time. I will facilitate a Q&A session with our team at the end of the webinar. I would now like to invite Samantha to begin by sharing what prehab is and why it is important.
Thanks, Melissa. So the number one predictor of the recovery and how well you do in recovery after a knee replacement has to do with how strong you are going into the knee replacement. So what we really focus on in prehab is getting your muscles as strong as they can be without increasing any type of pain or discomfort. There's a lot of different ways we can do that. So a few ways is can be going in different non-weight bearing positions. So that would be strengthening your knee without you having to put weight through it. We can also help you with aquatic therapy. A few of our clinics through Phoenix do offer this, and that is a great way to help strengthen your muscles without having to increase your pain at all. And finally, there's also a lot of different hands-on treatments that we can do through manual therapy that can help control your pain and get you through some of the strengthening activities before your replacement comes up. So a lot of the times when you come into therapy, we will talk to you about what to prepare for the few days after surgery as well. So with that, I'm going to send it on over to Devin, who's now going to talk to you a little bit about some tips of things you can purchase to make your recovery process easier.
Thanks, Sammy. So there are many different things that you can have on hand to help with your recovery following surgery. One of the most important things and the things people enjoy the most is to have multiple ice packs on hand. The hospital will often send you home with one or two, but it's good to have multiple so that they're always cold and ready to go when you need them most. The bigger the ice pack, the better. That way you're able to wrap it the entire way around your knee instead of just the top or the bottom. Many times you're going to go home with a walker after surgery, but you're often going to transition to a cane before walking without any device. Having a cane on hand can be very helpful, and we will always fit your cane and your walker specifically to you so you can get the best results when you're walking. Having multiple grab bars in your shower can make it easier and safer to get in and out of the shower, especially if you have to step over a tub. A shower seat can also be beneficial to prevent slips and falls in the shower, or if you are tired and you can't stand for long periods or hold your balance. You can buy grab bars at your local home improvement stores that just suction onto the shower to prevent you from having to do a lot of remodeling, and they are good for easy removal when you don't need them anymore. If the hospital is not going to give you a strap to help you lift your leg, it's a good idea to have one. Usually we suggest a dog leash or a belt, and it can help you lift your leg while you're getting in or out of bed, in and out of a car, or just help with your general exercises that you're going to be doing for the first 1 to 2 weeks. Don't be afraid to ask around to your friends and family to borrow some of these items because you're only going to be using them for a short period of time. Many people have already gone through these surgeries before, so they can have them laying around and might loan them to you instead of you having to purchase them. Katie is now going to share what you can expect for your initial evaluation.
Awesome. Thanks, Devin. So upon arriving into the clinic, you will be greeted by one of our patient care coordinators. They are going to walk you through your initial paperwork and as well as go over any insurance information that they have for you regarding your benefits with physical therapy. So after you're done completing your paperwork, you'll then be greeted by your physical therapist to begin your evaluation. During your initial evaluation, your PT will start by talking to you about how you are feeling, what current limitations you may be having, and what your goals are. This is to get to know you as a patient and as a person, and to get a good picture of what your specific situation is. They'll also review any relevant medical history that you may have as well. So after this, the therapist is going to take some measurements with you to get a baseline. These measurements may include range of motion of your knee and of other body parts too, depending on what your limitations are. They're going to test your strength, certain functional mobility tests, as well as walking and balance assessments. As Devin said earlier, we will also do assistive device measurements as well with a cane or your walker. From here, based on what your PT finds in the evaluation, he or she may do a few other treatment techniques with you right at day one, depending on how you feel. And then usually after this, lastly, they'll go over some exercises to do with you at home just to get your therapy program started. So now Monica is going to highlight what you can expect from the general progression of treatment.
Thank you, Katie. So first off, an average physical therapy session is about 60 to 90 minutes. And that consists of a variety of different things such as education, strengthening exercises, flexibility exercises, functional mobility training, and or pain management. Pain control is a constant goal. We try to minimize as much pain as possible. We understand that there is some discomfort that we would expect, but we do try to minimize excessive pain. We do that by using ice packs, heating pads, ultrasound, some hands-on treatment like massage, as well as electric stimulation. We can go to the next slide. Generally, treatment progresses in a couple of different ways. The first one is going from passive to active activity. What this means is that in the beginning, your physical therapist will physically help your knee bend and straighten in order to teach you how to correctly move. Eventually, as you get stronger and your muscles learn the correct movement patterns, you'll be able to do it on your own without compensating. Secondly, you'll move from a mobility-focused treatment to a stability-focused treatment. That's because your therapist wants to make sure that the joint has full range of motion and is flexible enough before you start doing much strengthening exercises through the range of motion. And finally, your program will go from isolated exercises to integrated functional exercise. So an example of that would be using ankle weights or using resistance bands to work on strengthening your knee to be able to bend and straighten in the beginning of therapy. As you progress throughout your treatment program, you'll eventually start working on more functional exercises such as squatting, lunging, or going up and down stairs. Those are functional mobility skills that require strength in multiple muscle groups working together. Ultimately, the end goal is to get you independent with a functional home exercise program. I'm going to now let Alisha explain why exercises are important for recovery.
Thanks, Monica. So there's a variety of reasons why exercises are important for recovery. So I'm going to talk about today the three main reasons why we need you to go to PT, why it's important to get prehab, and also why it's very important to be dedicated and consistent to your therapy. It's a very valuable tool that you're going to need to do well in order to regain your full potential. So the first reason why exercises are important for recovery is to increase the mobility or the range of motion of your knee and oftentimes your hip and your ankle. So following an injury or after knee surgery, you're not going to be able to bend your knee or straighten it as much as you did before your injury or before surgery. This can significantly impair your ability to do certain things, such as going up and down the stairs, walking, squatting, and getting in and out of the car. So it is important to regain normal bending and straining of your knee as the #1 priority early on in your rehab. Also, you would be giving home exercise programs initially that will focus on the mobility and range of motion of your knee. The second reason why exercises are important in the recovery process following knee surgery is to increase the strength of your knee, but not only the strength of your knee, but also the strength of your hip and your ankle. So oftentimes following an injury or surgery, the muscles of your entire lower leg become weakened or inhibited. And what this means is the strength of the contraction isn't as strong, or the muscle isn't contracting in the appropriate way. And this can impair your ability to do normal things, such as simply lifting your leg up off a table. And that's why earlier Devin recommended getting a strap to help you to lift your leg initially. It can also impair your ability to walk, squat, get in and out of the shower. And so strengthening exercises are going to be targeted on your knee, your hip, and your ankle in order for you to be able to do initially simple things like lifting your leg off the table, being able to actively bend your knee back, and then they'll progress to doing some weight-bearing things. So without strengthening the muscles around your hip, your knee, and your ankle, you may never get back to doing the activities that you once were able to do. So that's why it's very important to be consistent with the strengthening exercises that your therapist gives you, not only in therapy, but also in your home exercise program. Finally, probably the #1 reason why exercises are important for recovery is because it gets you back to your original function and gets you back to doing the things that you love to do. So this is the ultimate goal of therapy, and together your therapist will work with you for what goals specifically apply to you. So for example, some of you may be runners and you're looking to get back to running. Some of you may just want to get back to your normal walking routine. Some of you may be lifting weights and need to be able to squat and perform in that way. And so exercises at the end of the treatment program are designed to improve your function. This will allow you to get back to doing the things that you love to do, and is the ultimate goal of why you're coming to therapy and why we as therapists want to help you achieve. And like I said earlier, your therapist on your eval will talk to you about goals that are specific to you. At Phoenix, we like to do a lot of very personalized treatments and treatments that are going to be designed specific for you. You won't get a cookie cutter approach. Everything is going to be designed with your goals in mind. So like I said before, increasing your function is the ultimate goal of therapy, and is in turn why exercises are so important throughout your rehab process.
Thank you, Alisha. At this time, I just wanted to let you all know that we're going to open up for Q&A. But before we start taking questions, I just wanted to ask, how far in advance of surgery should someone do prehab?
Yeah, Melissa, I can answer that one. So typically, it would be ideal if you could begin prehab around 6 to 8 weeks before your surgery. It takes around this time for consistent therapy and consistent exercise to gain muscle, and it will allow you to go into the surgery with you feeling the strongest, and will help you with your recovery as well. So during these prehab appointments, your therapist will be able to also provide you with a home exercise program, like mentioned previously, that will help you progress through your strength. So like Alisha mentioned, it won't be just a cookie cutter kind of thing. It would be very directed to you as a person and your goals as well. So around 6 to 8 weeks is when you would want to make that first appointment.
Okay, great. And just to follow up with that, I guess my next question would be, when should someone start physical therapy after surgery?
So I can take that, Melissa. If you continue with outpatient physical therapy after surgery, you will likely be scheduled as soon as possible after leaving the hospital. After most knee replacements, if there are no complications, you are usually discharged within 1 to 2 days after surgery, and you would begin outpatient PT as soon as possible after that. So a lot of times we usually suggest to patients to schedule their physical therapy evaluation in advance to guarantee that they're able to get in for their eval within 1 to 2 days after being home from surgery.
Thank you very much for that, Katie. And Samantha, thank you for your answer as well. So at this point, I would now like to ask you to please feel free to use the chat function to ask the team any questions you may have about the webinar today. Okay, looks like we do have 2 questions. I'm seeing, what exercises do you suggest to do before surgery? Brian asks.
I can take that. I can take that question. So that's a hard question to answer, but I'm going to try my best. And so first off, what you're going to want to do is you're going to want to do some exercises that are going to get your knee to be able to bend and straighten as far as you can possibly do. So some exercises may include, like if you're laying on your table and this is the knee we're working on, what you can do is you can just slowly and gently work on bending and straightening your knee. Okay, that's like one of the most basic ones because you want to have a lot of range of motion initially. Another thing that you can do is you can put a towel roll under your ankle and you can push your leg straight like this and hold it for a couple seconds. This will serve 2 purposes. It'll get the extension mobility or the ability to straighten your knee out, and it'll also start to activate the main muscle on the front of your thigh called your quadriceps. Some exercises that you can do for strengthening your hips in preparation for that is you can lay on your back and just lift your leg up and down like this. You can also do it laying on your side, lifting up and down like this. And then also laying on your belly where you actually lift your leg back. Those are some very simple exercises that are easy to do and hopefully won't cause a whole lot of pain when you're doing them. And that could get you at least started for your exercise program. Now, I would suggest, if possible, scheduling an appointment because there's going to be certain things that could be more beneficial for you in your prehab. And oftentimes the way that prehab is you go for like 1 or 2 visits and then we give you a home program and then maybe we'll check in with you the next week, maybe do 1 or 2 visits again. So there's a lot of stuff that we can give you specifically to do individually that will be targeted best for your injury or the type of surgery that you're having.
Thank you, Alisha. So our next question comes from John, and he was wondering, what if pain doesn't allow you to do any prehab in all reality?
I could take that one. So a lot of times you're getting surgery because you have pain. So this is a pretty common question. Otherwise, you wouldn't be getting the surgery. So the best thing that you can do is just keep moving. So walking is really great. So if it's just, 1 lap around your kitchen to dining room, but you do that multiple times a day, you can do that instead of a full out exercise program. but a lot of these exercises are very simple and they can actually decrease your pain by doing them because they're non-weight bearing exercises. So definitely we can give, like Alisha said, come in for 1 or 2 visits and we'll give you a program that will also help to reduce your pain at the same time and teach you some pain management techniques. So there's always something we can do and something we have up our sleeves to help even if you are painful.
To piggyback off that, Devin, aquatic therapy is a really good option if you do have a lot of pain. So a lot of times your therapist can give you specific exercises to do in the water, and some of our clinics do have pools that are actually warm, so they kind of feel good on the knee. But you can also go to your local gym and do a aquatic exercise routine, as it reduces the weight bearing and can help with pain.
Thank you both. So our next question comes from Joy, and she was also asking what type of knee exercises do we recommend. Her father-in-law just got done with his knee replacement surgery last month and is now in the physical therapy part of recovery.
I'll take that one. So Joy, I would say if he's in PT now, his therapist hopefully is working with him, depending on the stage that he's at with his surgery. Well, if it was last month. So he's probably more progressing through the range of motion phase into the more functional, strengthening functional phase at this point. So it really is just going to depend on where he's at in the process, and hopefully his therapist is working with him and his goals depending on how he's doing. So it's really hard to say exactly what specific exercises we'd recommend for him at this point, but I would like to think that he's still probably progressing his range of motion and starting with his strengthening and functional mobility exercises.
Thank you. So our next question comes from Anna, and she is wondering about meniscus tears. At what point should one have surgery, and what alternatives are there to surgery?
I'll take that one, Melissa. I think typically with the meniscus tear, if it gets to the point that your knee is locking or you're experiencing issues with getting down, like squatting, kneeling, going up and down the steps because your knee actually locks in place due to the cartilage from the meniscus blocking the knee joint from moving correctly, that's typically the point where surgery is kind of unavoidable. Otherwise, typically physicians will recommend that you do physical therapy first because small meniscus tears can do really well with just some exercises and some neuromuscular retraining. There are other treatment options out there, and that would come at your physician's discretion, such as different types of injections and medications and so forth. But physical therapy is typically the starting place after you have a meniscus injury.
And I just wanted to add on a little bit to that as well, Monica, how with your meniscus, there is part of it that can heal on its own. So there is a chance, depending on how big your tear is, that, like she said, with therapy, that it can heal without you having to do surgery. And there's also a lot of things we can do hands-on wise with manual therapy, getting your knee moving in certain positions and really trying to open up your joint to get that range of motion to try to help with some of that locking before you would have to take that next step.
Great, thank you both. So we do have 2 more questions. Our next question also comes from Anne. She is wondering if we could talk about the, and I'm sorry if I'm saying this incorrectly, jiffy knee replacement surgery.
I can take that one.
Thanks, Alisha.
Yeah, sure. So the jiffy knee replacement surgery is just another name for a non-invasive type of surgery. And so what happens is they don't have to cut through the muscles to kind of get to the joint and repair the joint. A lot of times people have found that, and there's some research out there that suggests that the recovery time and the recovery process is a little bit less painful and a little bit shorter because of the minimally invasive aspect of it. Most likely the incisions, traditionally a knee replacement surgery has a long incision down, the front of the knee. Typically the jiffy one is the incisions are a little bit smaller, and basically the surgery isn't as involved, or the incision and there's a little bit less damage done to the tissues around the knee to try to get in there to replace the knee.
Thank you. So we have 2 more questions, and they come from Brian. Brian's first question is, he needs both of his knees replaced as they're not in great shape. He's 48 and started running before it became too painful for him. He is wondering if you've seen patients with both knees replaced get back to running.
I can take this one. So I've had a good bit of patients actually with the bilaterals, and for the most part, they actually do better quicker that I've seen, because you can't compensate. So both knees are done, you have to use both of them. So your recovery, actually, they do very, very well with these. I actually have a patient right now, she had bilateral done, and she is back to doing like Zumba, pound classes, aerobics, you name it. She pretty much does the exercise. So it's definitely possible if you follow everything you need to follow, and everything in your recovery goes really well, that you can get back to pretty much any task that you want. And most of the time people don't really notice they actually notice that their function is better after the knee replacement. So they don't lose a lot of function just because you have a knee replacement.
Yeah, I'd like to speak on that a little bit. So at the clinic here, I treat a lot of runners, and I have a specific running analysis program that I do, and I have a lot of runners, and I've actually treated in the past 1 or 2 gentlemen who have had bilateral total knee replacements, and they have gotten back to running. What is unique about the running aspect is the mechanics of the foot and the ankle and the hip kind of have to be normalized in order for you to have the best running form. And going through therapy and initially telling your therapist, like, my goal is to run again, so they'll be able to work on the strength and the mobility of the specific joints that you need to have good running form. And oftentimes, like Devin said, maybe now you're not able to run because of the pain, or there's arthritis in there. Once you get the replacement, you work through the strength, and then your therapist will provide you with a running progression, so you won't go out and run like a marathon or anything right away, but it would be a gradual buildup. But I've definitely seen it happen, and it's definitely it's very feasible for you to get back to running.
Thanks, Alisha. So Brian's last question is, assuming the surgery goes well, what are the prospects of getting back to being able to squat and bend and just move your knees normally?
I'll take that one. So the good thing about knee replacement surgery is that, unlike some hip replacements, there aren't precautions that you have to follow. From the very beginning, it is bend your knee as far as you're able to tolerate and extend it as far as you're able to tolerate as well. So what that means is that you can work on regaining full mobility in both directions, which would allow you to be able to do things like squatting and different like flexibility exercises, using that hopefully improved range of motion that you didn't have prior to surgery. Like Devin said, that she's worked with patients who are able to do cardio, they're able to do Zumba, they're able to do aerobics. So as long as the surgery is uncomplicated and nothing else comes up, there is no reason why you would not be able to move your knee normally after doing PT.
Thank you, Monica. So that is the end of our questions for right now. So thank you all for taking the time to join us today. If you have any other questions, please feel free to email us at marketing@phx-pt.com, as you can see on the slide there. And if you're looking for a location near you, you can check out our website. The locations page shows all of our locations, so you can find the clinic nearest you. So please let us know if you have any other questions. We appreciate your time today, and have a great day.
Thank you.